cover three concepts. The first is assertiveness from nurse to client. The next is assessment of pain in the older client. And lastly, sharing critical information with the use of SBAR. So assertiveness, the goal here is to communicate directly, standing up for your own rights while respecting the rights of others. So there are four components of assertion. Number one is to say no. Number two is to ask for what you want. And number three is to state positive and negative thoughts and feelings. Number four is to initiate, continue, and terminate the action. The next topic is pain, and here we're going to focus on more of the older client because sometimes it's harder for the older client to express their level of pain, even if they're not cognitively impaired. So what we're going to ask the client to do is to describe the quality of pain, whether it's like a sharp pain, an aching pain. Also, sometimes it's useful to use the word discomfort instead of the word pain in some situations. Identify when the pain occurs, identify different pain patterns, describe how it affects the client's active daily living, such as showering, brushing their hair, define where the pain occurs, like whether it's deep or surface pain. Lastly, we're going to talk about SBAR. It stands for Situation, Background, Assessment, and Recommendation. It's a great way to share with physicians and other team members when there's a sudden change in the client's situation. The SBAR should be concise, convincing, and it should express the severity of the client's condition.
Hello? Hello?
Hi, Mr. Sorensen. I'm here to take your glucose stick because we need to check your blood sugar. Can you please state your name and date of birth for me?
Dustin Sorensen, January 7th, 1991.
Okay.
Yeah. I really gotta use the restroom.
Okay, well let me go ahead and take your glucose stick real quick, because it takes just a few minutes, and then I can go ahead and bring you a bedpan, okay?
No, I really need to use it now.
You seem really upset.
Yeah, you know, I really have to use the restroom, and I don't want to be peeing in this bed. You know, that's something I did in my childhood, and I don't want to be doing that anymore. I mean, I just want to use the bathroom like I always do, like I normally do, and I just want to go. I just don't want to pee in the bed.
No, Mr. Sorensen, I know it is uncomfortable for you to use the bedpan right now, but it is important for us to keep you safe, and we want you to stay in bed until we can send you down for an MRI. Can you please work with me by using the bedpan just for now?
Yeah, I guess I can use the bedpan for now.
Okay, thank you. Let me go ahead and get your supplies for the glucose stick. It'll just take a few moments, and I can come back in and help to assist you in a comfortable position, okay?
Okay. Hello?
Hi, Mr. Sorensen. I'm here to give you your Zofran pill. Did you have any water that you wanted to take it with?
Sure.
Mr. Sorensen, you seem to be in pain.
No, not really. No pain here.
Do you have any current discomfort?
Yeah, just a little bit in my stomach.
Can you describe this discomfort for me? Is it like stabbing, burning, or is it an aching pain?
No, just stomach just hurts, you know, it just feels like a cramp.
When does this discomfort or cramp-like feeling occur?
I don't know, whenever I'm moving, I guess, standing up or walking around, just kind of all the time.
Is there anything that can help this discomfort go away?
I don't know, when I'm sitting down, I guess this is the best it's felt, just sitting down and bent over on it. I've just been holding onto this pillow for a while, and it's kind of helping, so.
Okay. Does your discomfort affect any part of your day? Or all of your day?
Yeah, I mean, I just want to stay here all day. I don't want to do anything. You know, my family's coming later, and I don't want to go walk around with them. I just want to stay here.
Okay, I see. Is it more of a deep pain or like a surface pain on the top of your stomach, or just more in the middle, deep?
It's kind of all over, I guess. I mean, it's kind of deep. Just right around my stomach area. It just kind of hurts.
Hello?
Hi, Dr. Smith. I am calling about Mr. Mozak, who is currently having uncontrolled hyperkalemia. He is a 60-year-old man with chronic kidney failure and a history of diabetes type 2. His potassium levels have normally been 5.3, but they have been consistently raising to 6.1. Mr. Mozak has reported cramping in his legs along with his abdomen, and he says he has some diarrhea. He also reports that he's very weak. I checked his electrocardiogram, and I noticed a flattening P wave and a widening QRS complex. His blood pressure has increased from 124/82 to 180/106. I need you to see him right away. I think he needs immediate dialysis.